My name is Samantha Renson, and I'm a second-year athletic training student at OSU, and I did my presentation over the relationship between hip range of motion and shoulder pain in adolescent baseball athletes. Now, for my introduction, in the United States alone, baseball is one of the most common sporting events that adolescents take part in. Annually, over 5 million adolescents participate in baseball. Throwing a ball puts an immense amount of stress onto the upper extremities, especially the shoulder. If there are deficiencies at any point during the throwing motion, the stress placed on the shoulder will grow even more. This compensation could possibly originate from the hip and the joint's range of motion. Decreased range of motion could lead to poor mechanics and an increase of pain in the shoulder during the throwing motion. For my objectives, the purpose of this critically appraised topic is to investigate the correlation between shoulder pain during the throwing motion and a decreased amount of hip range of motion. For my methods, I looked at 5 studies that looked at how the throwing mechanics of adolescent baseball athletes could be causing shoulder pain. Each study utilized goniometry to determine hip range of motion of each subject and a specific self-reported pain rating questionnaire to determine the subject's shoulder pain. Each study included participants under the age of 18 who did not have a previous history of shoulder injuries or genetic disorders affecting the musculoskeletal system, and included field players as well as pitchers. For my results, all of the researchers had used goniometry and used the one set of researchers to measure the hips range of motion and continued to use the same researchers while measuring. For at least one of the studies, they explained that one researcher would hold the non-tested limb onto the table while the patient laid down, and while the other passively moved the tested limb for the hip while they measured passive range of motion. Now, 4 of the 5 studies supported that deficient hip range of motion impacted shoulder pain, and 4 out of the 5 studies rated a 6 out of 10 on the Pedro scale or higher. For my conclusion, in all of the studies included in this synthesis, subjects in the adolescent age range with no related or previous history of injury to the shoulder were assessed for complaints of pain. Each study utilized goniometry to measure hip range of motion and a self-reported pain scale. 4 of the 5 studies that were included supported the notion that a deficiency in hip range of motion could lead to compensation patterns that contribute to shoulder pain in adolescent baseball athletes. I also wanted to say a thank you to Dr. O'Brien for guiding me through the research process, and a thank you to all of my classmates for their support.